Hi, my name is Dr. Steve Lindheim. I'm a professor here at the University of Cincinnati and medical director for the Center for Reproductive Health. Today, I'm delighted to be with you and share with you some very valuable information regarding saline-infused sentinel histogram that will affect the quality of care you give your patients. Saline-infused catheters are used primarily for two reasons. In the office setting, gynecologists perform sentinel hysterography primarily for abnormal uterine bleeding, where sterile saline is infused into the uterus while transvaginal ultrasound is performed. Second, by an increasing number of radiologists who are performing hysterosalpingography, where an X-ray using a fluoroscopic dye that is injected into the uterus and fallopian tubes. There also happen to be a number of other clinical indications for performing SIS in addition to abnormal uterine bleeding. These include infertility and recurrent pregnancy loss, ruling out congenital abnormalities of the uterus, pre- or post-operative evaluation of resection of uterine fibroids, polyps, and suspected uterine cavity synechiae. And lastly, inadequate assessment of the endometrial stripe that routinely is noted on transvaginal ultrasound in the peri- and postmenopausal women, where more times than not, it may be difficult to see. There are a number of different catheter systems currently on the market. My personal preference is the Elliptosphere catheter by CooperSurgical. In contrast to the original balloon system, which has an all or none inflatable balloon, the newest version, called the Elliptosphere, is a unique, patented polyurethane non-latex balloon which allows you to have a graduated inflation of the balloon as necessary to achieve a tamponade effect, thus ultimately preventing egress of the distension media. With full inflation of the elliptosphere, using 1.5 cc's, the balloon becomes round. This allows for flexibility for the multiparous patient, where they're more likely to have egress of the fluid through the internal os. This sterile 5 French single-use catheter system replaces the older 5 and 7 French SIS catheter systems. Furthermore, as it allows one to marginally inflate the balloon, one can keep this in the cervical canal, which provides better visualization of all the lower uterine segment, and randomized clinical trials have revealed significantly less pain with placement in the cervical canal. The Elliptosphere catheter consists of a latex-free balloon with an inner sheath and a 1.5 cc syringe. The newest feature of the Elliptosphere is an integrated stylet that allows for molding as well as memory of the catheter system. This aids in the challenging stenotic cervix as well as the severely angulated anti- and retroverted uteri. For the provider doing transvaginal sonography and SIS, a sterile aqueous-based media including saline may be indicated. For those performing HSGs, an oil-based contrast media may be used. In addition to some of the existing features, there are some new added benefits to the Elliptosphere system. Similar to the older CooperSurgical catheters, once the balloon is inflated, the clinician has a free hand to operate the ultrasound machine. In contrast to non-inflatable balloon systems, the operator more often must keep one hand on the catheter and the other on the probe. Second, the patented Elliptosphere balloon allows for incremental adjustments of the balloon's distension, which in turn attenuates patient discomfort. Thirdly, control of a balloon contour allows for placement in either the cervical canal or uterine cavity. This gives flexibility based on the patient's clinical situation, including being nulliparous or in those multiparous patients. Now, I must conclude by saying that we clearly know that there are a number of contraindications. Those include suspected infection, suspected pregnancy, or sexually transmitted diseases. Thank you very much for your attention, and have a great day.